Ranolazine is used to treat a certain type of chest pain, also known as chronic angina. It helps to decrease the frequency of chest pain and may improve your ability to exercise. Unlike other angina medications, ranolazine works differently and can be used in combination with other angina drugs such as nitrates, amlodipine, and metoprolol. It is believed to work by improving the heart's ability to use oxygen more efficiently, allowing it to do more work with less oxygen. Before taking ranolazine, make sure to read the patient information leaflet provided by your pharmacist. Take this medication as directed by your doctor, usually twice daily. Open the packet and sprinkle the contents onto a tablespoonful of soft food and eat it right away. Do not crush or chew the mixture or save it for later use. Also, avoid alcohol while taking this medication, as it can increase the risk of side effects. If you are using a feeding tube, mix the contents of the packet with water as directed. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Do not increase your dose or use this drug more often or for longer than prescribed. Use this medication regularly to get the most benefit from it, taking it at the same times each day. This medication should not be used to treat angina when it occurs. Use other medications to relieve an angina attack as directed by your doctor. If your condition does not improve or gets worse, be sure to contact your doctor. Side effects of ranolazine or 1000 mg granules, extended release in packet may include dizziness, headache, lightheadedness, nausea, tiredness, or constipation. If any of these effects persist or worsen, contact your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as signs of kidney problems or very serious side effects like fainting, severe dizziness, or fast/irregular heartbeat. While it's rare, a very serious allergic reaction to this drug may occur. Seek immediate medical help if you notice symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Remember that if you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada. Before taking ranolazine, it's important to tell your doctor or pharmacist if you have any allergies or if you are allergic to it. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. Before using this medication, make sure to share your medical history with your doctor or pharmacist, especially if you have liver problems such as cirrhosis or kidney problems. Ranolazine may cause a condition that affects the heart rhythm, known as QT prolongation. This can rarely cause serious fast or irregular heartbeat, fainting, and other symptoms that require immediate medical attention. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. It's essential to inform your doctor or pharmacist about all the drugs you are taking and if you have any certain heart problems or a family history of certain heart problems. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation. This risk may increase if you use certain drugs like diuretics or if you have conditions such as severe sweating, diarrhea, or vomiting. It's important to talk to your doctor about using ranolazine safely. This drug may cause dizziness, and using alcohol or marijuana can make it worse. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. It's also best to avoid alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially QT prolongation. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so it's best to consult your doctor before breastfeeding. It's important to be aware of how ranolazine interacts with other medications. This can affect how well ranolazine works and may increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medications without your doctor's approval. Other medications, like certain antifungals, antibiotics, and HIV protease inhibitors, can affect how your body removes ranolazine, so it's important to discuss all your medications with your healthcare provider. If you suspect someone has taken too much of this medication and they are experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe dizziness, fainting, fast/slow/irregular heartbeat, changes in mental state, such as confusion or hallucinations, seizures, and unsteadiness. It's important not to share this medication with others. Your doctor may also schedule lab and medical tests to check on your kidney function while you're taking this medication. It's important to keep all your medical and lab appointments. If you have any questions, consult your doctor for more details. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed dose. Remember to store Ranolazine Air 1000 mg granules, extended release in packet at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it's expired or you no longer need it, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.